the premiums are lower than you could buy on your own, then we'll offer you some tax credits to make it affordable. And those tax credits would add up to the largest middle-class tax cut for health care in history. So, it's estimated that this would drive down the costs for folks who don't work for big companies, so they don't get as good of a deal, by 20%. This is before the subsidies, before the tax credits. Now, it's true that this will cost some money. It's going to cost about $100 billion per year. That's real money. That's a lot of money. But most of that money comes from the nearly $2.5 trillion a year that America already spends on health care that we're not spending well, that we're spending badly right now. So, we pay for this proposal by getting at the abuse that we just talked about. We eliminate wasteful taxpayer subsidies that go to the insurance companies. Do you know that through the Medicare program, we are giving insurance companies close to $20 billion a year, about $18 billion every year of taxpayer money through the Medicare system. And we're saying, well, why do we do that? They're making a profit on their own. And while some of what we save goes to helping the uninsured, most of it goes back to small businesses and the middle class who right now just aren't getting a good deal. It doesn't make sense to me that people who are really poor are able to get Medicaid, but people who are working really hard and just not quite as poor, they don't get a decent deal. That doesn't make sense to me. All right. That's the second part. First part, insurance reform. Second part, creating this marketplace where small businesses and individuals can get a good deal. Third part, bringing down the cost of health care for families and businesses and for the federal government. Cost control. Now, when you listen to the other side, they'll tell you, we want to do more about costs. We want to do more about costs. Well, let me tell you, we've incorporated almost every serious idea from across the political spectrum about how to contain rising health care costs. There's not an idea out there that we have not worked on, that we have not included in this proposal. And according to the Congressional Budget Office, this is the office that is supposed to be the independent referee for how things cost. It's not supposed to be Democrat or Republican. According to the Congressional Budget Office, people buying health plans in the individual market right now, they'd see their premiums go down 14 to 20%. I already mentioned that. Now, here's another thing. A recent study by the Business Roundtable. That's made up of all these big companies out there. They're nonpartisan, but it's not like they're just dyed-in-the-wool liberal Democrats. Let's put it that way. These are company CEOs. They commissioned a study and said the reforms could reduce premiums by as much as $3,000 per employee. That's their study, not mine. Then the Congressional Budget Office said that the government would save $1 trillion. Reduce the deficit by $1 trillion. So think about it. You're saving money, employers are saving money, the federal government is saving money. Not according to me, but according to these studies that were done by independent analysts. So here's the bottom line, St. Charles. There's no government takeover, unless you consider reining in insurance companies a government takeover, and I think that's the right thing to do. There's no cutting of Medicare benefits. They're just cutting out fraud and waste in Medicare to make it stronger. What we're proposing is a common sense approach to protecting you from insurance company abuses and saving you money. That's the proposal, and it is paid for. And I believe that Congress owes the American people a final up or down vote on health care reform. The time for talk is over. It's time to vote. It's time to vote. Tired of talking about it. Of course, folks in Washington, they like to talk. And so Washington's doing right now what Washington does. They're speculating breathlessly, day or night. Every columnist, every pundit, every talking head. Is this proposal going to help the Republicans, or is this proposal going to help the Democrats? What's going to happen to the president's polls numbers if the vote doesn't go forward? If it does go forward, what will it mean for November? What will it mean for 2012? How's the politics going to play? I heard the Republican leader of the Senate the other day. He's warning Democrats. You better be careful about voting for this. It could hurt you. Now, I don't know how sincere the Republican leader is about the best interests of Democrats. He's been very generous with advice. You know what? Here's the bottom line, St. Charles. I don't know how the politics play. I don't know. This is a hard issue. It's a complicated issue. There's a lot of information floating around out there. A lot of it's inaccurate. The opponents have spent millions of dollars fighting it. And people during recessionary times, they're anxious and sort of thinking, gosh, can we really afford to change things right now? Maybe we should just kind of stick with the status quo, even though we know it's not working for us. So I don't know how the politics plays. But here's what I do know. The American people will be more secure with this reform. Our country will be stronger because of this reform. I don't know about the politics, but I know it is the right thing to do. And that's why I'm fighting so hard to get it done. We've seen years, decades, where Washington just puts off dealing with our toughest challenges because it's too hard, because we don't know how the politics works. And the will and the capacity to act, to do serious things in this country, starts just getting sucked away, just gets sapped by partisanship and political gamesmanship and debates about who's up and who's down and how does this play politically, instead of asking what's right and what's wrong. And we've seen terrible consequences. Not just these last 2 years of turmoil, but a decade of struggle for middle-class families. We can't accept the status quo. We can't accept the same old, same old. I won't accept it. Claire McCaskill won't accept it. Not when it comes to how we manage taxpayer dollars. Not when it comes to how our health care system works. Not when it comes to meeting the difficult challenges that we face. And that's why Claire and I are fighting to stop waste and abuse in our government. That's why Claire and I are fighting to pass these health insurance reforms. Now is the time. Now is the moment. Now is the time for us to leave for the next generation and generations to come a stronger and more prosperous country. We are not backing down. We are not quitting, St. Charles, and we are going to get this done. Thank you. God bless you. And God bless the United States of America.
After this event in St. Louis, President Obama will make remarks at a fundraiser for Senator Claire McCaskill, and then a reception following that event. President Obama returns to the White House later tonight.